My name is Cynthia Martin. I'm 54 years old. I was diagnosed with diabetes and I have PAD. I just noticed there was a small something sore on my foot, and it was kind of like it wasn't real painful, but it was nagging me. So I went to a podiatrist. Eventually, I realized I had circulation problems.
I didn't even know her wound was that bad. Her whole heel was almost completely gone.
And they referred me to a vascular doctor, and he recommended amputation. And I was heartbroken. I was shocked. I'm an ex-federal police officer, so the thought of me without legs, that really hurt. My main focus is I wanted to keep my legs, my limbs. So, and I'm glad that I decided to get a second opinion.
At the point where I met Cynthia, she already had a couple of unsuccessful stent placements to try and restore blood flow to her legs. Unfortunately, these were not successful. She was fortunate that we could still do bypass surgery to open up these blockages. Once her circulation improved, the Inova team worked for months to save Cynthia's legs. This included not just the bypass to reroute the blood flow around her blocked vessels, but also continuing treatment at the Inova Wound Healing Centers. They used grafts of skin substitutes with living cells to generate new, healthy skin and speed the healing process, as well as a special boot to remove pressure from her foot.
Fortunately, Cynthia did an internet search and found the Inova Wound Healing Centers. They immediately recognized the urgency of her condition and involved vascular surgery to determine what options were still available to save her legs. For many people like Cynthia who have diabetes, they can develop peripheral arterial disease, which restricts the blood flow to the limbs and causes nerve damage called neuropathy, which causes limb numbness, weakness, or pain. Once that happens, it is more likely that wounds and infections affect the legs and feet and occur. Diabetic complications are one of the most significant risk factors that can lead to amputation when they are not well managed. Thankfully, estimates show that about 85% of all diabetes-related amputations can be prevented with early intervention and specialized treatment. The sooner we are able to intervene, the more options we have for successful treatment. For patients at risk of amputation, Inova's vascular surgeons, interventional radiologists, and wound healing specialists work together to offer specialized treatments, including minimally invasive endovascular procedures and sometimes vascular surgery. The best outcomes are created when these specialists all work together collaboratively to determine the optimal treatment. Cynthia's course of treatment has been complex, but she responded very well, and we are happy to see her back on her feet and getting stronger every day.
The Limb Preservation Center is a godsend, and it will help a lot of people.